The fluorescent lights in the pediatric ward never fully turned off, just dimmed to a pale wash that made everyone look slightly unwell, which felt appropriate, given where we were. I'd been a registered nurse at St. Catherine's for 3 years, long enough to know which vending machine would actually return your dollar, and which attending physicians liked their charts organized by time rather than priority, not long enough to stop feeling the particular weight of the night shift, settling into my shoulders sometime around 2 in the morning, when the hall went quiet except for the soft beeping of monitors and the squeaking of my sneakers against linoleum I'd already mopped twice. My name is June Hartley. I was 26 years old, renting a studio apartment in Kensington that my mother called cozy and my best friend called a cry for help, working 12-hour shifts 4 days a week because the overtime helped cover my student loans, and because honestly, I didn't know what I'd do with myself if I had more time to think. The pediatric ward at St. Catherine's was not glamorous. It smelled of antiseptic and microwaved soup. The walls were painted a yellow that someone had presumably believed would be cheerful and had achieved something closer to anxious. The kids who came through here were sick in ways that made your chest hurt if you let yourself think about it too long. So you learned not to think about it too long. You learned to focus on the task in front of you. The IV line, the dosage chart, the small hand you were holding while a child told you about their dog back home. The hospital was in the middle of a transition that nobody was particularly happy about. Meridian Health Group, a private equity firm out of Atlanta, had acquired St. Catherine's the previous spring, and since then we'd had 3 different administrators cycle through, 2 rounds of budget reviews, and a persistent rumor that the pediatric ward was going to be restructured, which in healthcare language meant gutted. We all knew what restructured meant. It meant cutting staff. It meant patient ratios that would make it nearly impossible to do the job properly. It meant the end of the things that made St. Catherine's different from a for-profit machine, the community outreach program, the sliding scale billing that kept low-income families from choosing between groceries and their kids' medication. My charge nurse, Patricia Okafor, had been with St. Catherine's for 22 years. She was the kind of woman who walked into a crisis the way most people walked into a room, with complete familiarity, like she'd already been there and knew exactly where the furniture was. She'd started calling me Junebug in my first week and never stopped, and I'd stopped minding it sometime around month 3. "They're sending someone," Patricia told me one Wednesday morning when I came in for the 7 o'clock shift. She was standing at the nurse's station with her arms crossed, which meant she was either about to give me a difficult assignment or information she considered equally difficult. From Meridian, some VP of operations type, here to assess the ward. My stomach dropped in the familiar way it had been dropping every time someone mentioned Meridian for the past 6 months. When? This morning. She raised an eyebrow. "So please, Junebug, for the love of everything, do not tell Mrs. Okonkwo in 412 that her insurance appeal is being handled by people who consider human suffering a quarterly budget line. Just smile and do what you do." I did what I did. I checked my patients, updated charts, coaxed a 7-year-old named Trevor into drinking his electrolytes by letting him pretend they were a potion, and tried not to think about the fact that someone from corporate was somewhere in this building deciding our fate. He came to the ward around 10. I didn't notice him at first, not really. I was at the medication cart outside room 408, triple-checking a dosage for a 4-year-old with a heart condition, because that's the kind of thing you check 3 times and then check again. I was murmuring the numbers to myself, which was a habit Patricia had once gently suggested might unsettle the patients' families, and I'd pointed out that it was either that or make a mistake, and she'd said fair enough. Fentanyl, 12.5 micrograms, weight-based, check. Timing, 0945, check. Route, excuse me. I looked up. The man standing in the hallway was not what I expected from a Meridian VP. I'd been picturing someone older, someone with the soft insulated look of a person who'd spent years in conference rooms. This man was maybe mid-30s, dark-haired, with the kind of face that was too angular to be conventionally good-looking, but somehow more interesting for it. He wore a charcoal suit that fit him, like it had been made for him specifically, which it probably had, and he was looking at me with an expression that suggested he was accustomed to people stopping what they were doing when he spoke. I did not stop what I was doing. 1 second, I said, and finished my check, capped my pen, and then looked at him properly. Can I help you? Something crossed his expression, not annoyance exactly. More like recalibration. I'm looking for the charge nurse, he said. Patricia Okafor. She's with a patient. Is there something I can help you with? I'm Garrett Walsh, from Meridian. I know who you are, I said, which wasn't entirely true. I knew who he was in the general sense. Corporate, here to assess us, potentially here to end us, without knowing anything specific about this particular man. Patricia will be out in about 10 minutes. There's a family waiting area around the corner if you'd like to sit. He didn't move toward the waiting area. He stayed where he was, watching me return the medication cart to its locked position, and I had the distinct impression he was doing the same thing I did with dosage charts, paying close attention, accounting for details. What are you working on? He asked. I looked at him. I'm sorry? You were reciting something when I walked up. Medication check. I verify dosages verbally before administering to pediatric patients. Reduces error rate. I paused, because something in his expression made me think he actually wanted to understand this and wasn't just making conversation. The ward uses a double-check protocol, but I add a third, belt and suspenders. Whose protocol is that? Mine. He was quiet for a moment. Does it work? I haven't made a dosage error in 3 years. He nodded slowly, like I'd given him a data point he intended to file somewhere useful. Then Patricia appeared at the end of the hall, spotted him, and her face arranged itself into the professional neutrality she used for difficult families and administrative visitors. Mr. Walsh, she said, extending her hand. Thank you for coming. I'm Patricia Okafor. He shook her hand, but his gaze came back to me for just a moment and I thought, but couldn't confirm, that something in his expression had shifted from assessment to something else. Mrs. Hartley's, he said, which surprised me because I hadn't introduced myself. He must have read my badge. Thank you for your time. I went back to work. The thing about a 12-hour shift is that it requires a particular kind of tunnel vision. You're not thinking about the man from corporate. You're thinking about Trevor's electrolytes and the family in 415 who needs a translator, and the supply order that got shorted on 22-gauge IVs again. The ward takes everything you have and uses it, and at the end of the shift you drive home, feeling scraped clean, empty in a way that's uncomfortable but also, strangely, a relief. No room for anxiety when you're that tired. No room for much of anything. I was charting at the nurse's station around 2 in the afternoon when I noticed Garrett Walsh was still on the ward. He'd been there for 4 hours, and he wasn't conducting formal interviews or demanding printouts. He was just watching. Moving quietly through the hallways, observing interactions between staff and patients, occasionally asking a question that seemed almost too specific. Not what's your patient-to-nurse ratio, but what happens when 407 and 412 need pain management simultaneously, and you have one nurse covering both. Nobody told him. He figured it out by watching. I found him in the corridor outside the family consultation room around 3, looking at a bulletin board covered in thank you cards and children's drawings that families had left over the years. It was the one piece of the ward that hadn't been touched by the yellow paint and fluorescent anxiety, because it was covered in construction paper suns and crayon signatures and photographs of kids who'd gone home healthy. He was reading them, not skimming, actually reading, moving slowly from one card to the next, and something in his posture was different from the careful corporate stillness he'd held all day. He looked, just briefly, like a person rather than a representative. I almost didn't say anything. I had a reason to be in that hallway. I was heading to the consultation room to prep for a family meeting, and the sensible thing was to walk past and let him have whatever moment he was having. That one's from 2019, I said instead, stopping beside him and pointing to a drawing in the middle of the board. It showed a stick figure in a white coat and a smaller stick figure with a bandage on its arm, both of them grinning. Below it, in careful oversized letters, "Thank you for fixing me. Love Danny. Danielle Park. She was 4 when she came in. Leukemia. She's 8 now. And apparently obsessed with soccer." Garrett Walsh turned to look at me. Up close, I could see that his eyes were dark brown, and that the weariness in them wasn't the routine end-of-workday kind. It was something older, more settled. You remember her, he said. I remember all of them. He looked back at the board. How many of these kids came from families who couldn't fully cover their treatment? I was quiet for a moment, recalibrating. That was not the question I'd expected. About 60% of our pediatric patients use some form of sliding scale billing or community assistance. The ward has a partnership with the Kensington Family Health Initiative that covers the gap for families who fall between Medicaid thresholds and private insurance minimums. I read about that program. He paused. Meridian's review flagged it as a significant cost center. My jaw tightened. It is. It's also the reason we have outcomes data that puts us in the top 15% of pediatric wards nationally. I know. He said it quietly, like a fact he'd already been sitting with. The correlation is in the quarterly report. Most people who read it assume the outcomes are despite the spending. I think they have it backwards. I stared at him. He turned from the board and looked at me with an expression that was harder to read than any chart I'd ever studied. The family meeting you're heading to, is it 409? Yes. The Reyes family. 8-year-old with a post-surgical infection. Father's been sleeping in the waiting room for 6 nights. How do you know that? I asked the overnight security guard. A pause. Go to your meeting, Ms. Hartley. I've taken enough of your time. I went to my meeting, but I thought about that conversation for the rest of my shift, turning it over like something I'd found, and wasn't sure how to classify. Patricia caught me before I clocked out. What did you say to him? She asked. Nothing. We talked about Danny Park's drawing. Patricia looked at me with the expression she used when she thought I was being deliberately obtuse. He asked me for a full copy of the community partnership data. The real data, not the summary version we give administrators. He also asked about your protocol for pediatric medication verification and whether it was a ward-wide policy or an individual practice. I pulled my jacket on slowly. What did you tell him? I told him it was yours. Individual. She paused. I also told him that if Meridian restructures this ward and loses you, they should plan on their outcomes data, taking a 6-month hit at minimum. She tilted her head. Was that wrong? Patricia, June Bug, I am 54 years old and I have watched this hospital go through 2 acquisitions. I know what the assessment visits usually look like, and this was not that. He has been on this ward for 6 hours. He ate in the cafeteria. He bought Trevor in 407 a juice box from the vending machine because the kid asked him for $1 and he only had a 5. I was quiet. He gave him the 5, Patricia added. I drove home in the November dark, my scrubs smelling like antiseptic. My feet aching in the way they always did after a long shift, and tried very hard not to think about a man, reading children's thank you cards with the expression of someone who had forgotten what sincerity looked like and was remembering it slowly. I did not succeed. Garrett Walsh came back to the ward 3 days later. This time he came alone without the administrative escort, dressed more casually in dark jeans and a jacket that still cost more than a week of my salary but felt less like armor. He arrived on the Thursday afternoon shift and came directly to the nurse's station, where I was updating charts. Miss Hartley, he said. Mr. Walsh. I kept my eyes on my screen. Did you forget something? No. He paused. I wanted to ask you a question that isn't in any of Meridian's review materials. I looked up then. Why pediatric nursing? He asked. You could have gone into almost any specialty. Your records show you declined 2 offers for critical care positions at higher pay grades. Why stay here? It was the kind of question that deserved a real answer, not a professional one, and I wasn't sure why I gave him the real one. My little brother was admitted to a pediatric ward when I was 12. He was fine. Respiratory infection, 3-day stay. But I remember the nurses. How they talked to him like he was a full person, not a small inconvenient version of an adult patient. How they found ways to make something terrifying feel manageable. I met his eyes. I've been trying to be that for someone else ever since. Garrett Walsh was quiet for a long moment. Can I take you to coffee? He asked. I blinked. You're Meridian's VP of operations for this region. I'm aware. You're currently deciding whether to restructure or close this ward. Also aware. This feels like a significant conflict of interest, Mr. Walsh. Garrett. He said it without breaking eye contact, and you're right, so I'll be direct with you. My recommendation to Meridian's board about St. Catherine's pediatric ward is due in 10 days. That recommendation will not change based on whether you agree to coffee. I'm asking because I want to talk to you, and I would like it to not be in a hospital hallway. I thought about Patricia telling me he'd given Trevor a $5 bill. 1 cup, I said, and you're buying. We went to a place called Wren and Sparrow, 2 blocks from the hospital, a narrow coffee shop with exposed brick walls, and the kind of pour-over menu that usually irritated me, but felt earned here because the coffee was genuinely excellent. We sat at a small table by the window, and I wrapped my hands around a ceramic mug and looked at the man across from me who held my ward's future in a spreadsheet somewhere in Atlanta. He wasn't what I'd expected. The corporate composure was still there. You could see it in the way he held himself, the deliberate economy of his movements. But underneath it something else showed through, the same thing I'd glimpsed in front of the bulletin board. A man who'd taught himself a specific kind of stillness and sometimes got tired of maintaining it. "How long have you been doing this?" I asked. "The acquisition assessments." 7 years. He turned his coffee cup once. "I started in finance. Real estate acquisitions. Healthcare was a later development. Do you like it?" He seemed to consider whether to answer honestly. "I'm good at it. I find distressed assets and determine whether they're genuinely failing or just underfunded and undervalued. Those are very different problems with very different solutions. And Catherine's? Underfunded and undervalued." He said it simply, like it wasn't the most important thing he'd said all week. "The pediatric ward is carrying outcomes metrics that a facility twice your size would struggle to match. The cost structure looks inefficient until you understand why the costs exist, and then it looks like an investment that hasn't been properly capitalized." I stared at him. "Then why are people afraid it's going to be shut down?" "Because Meridian's standard approach is standardization. Reduce variables, consolidate programs, improve margins. It works in about 70% of their acquisitions." He paused. "It would be a catastrophic mistake here. Are you going to tell them that?" "I'm going to try." There was something in the way he said it. Not the confidence of someone who always got what they wanted, but the careful honesty of someone who knew the system he was working within, and wasn't entirely sure it would listen. "What happens if they don't listen?" I asked. He looked at me directly. "Then I make a different kind of argument." I didn't ask what that meant, but I thought about it. We stayed for an hour and a half, which was longer than 1 cup of coffee required, and somewhere in that hour and a half the conversation shifted from St. Catherine's to other things. He'd grown up in Pittsburgh, he said, working-class neighborhood, father who did union electrical work, mother who'd been a teacher's aide. He'd been the first in his family to go to college on a full scholarship, and had spent the first several years of his career working with the focused intensity of someone who was afraid that if he stopped moving, everything would go back to what it had been. "It changes you," he said. "The work." I used to think I was solving problems. Somewhere along the way it started feeling more like I was just managing damage. Until? He was quiet for a moment. Until I walked into a pediatric ward and watched a nurse triple-check a medication dosage because she'd invented her own protocol to make sure nothing went wrong. And she didn't do it because anyone was watching. She did it because it mattered. I felt warmth in my chest that had nothing to do with the coffee. "Garrett," I said, and it was the first time I'd used his name and we both registered that. "What are you actually asking me?" "To trust me," he said quietly. "With your ward, with the data, with whatever you know about why this place works that isn't in the quarterly report." I looked at him for a long time. He didn't look away. "Okay," I said. "Over the next 8 days we worked." That's what I told myself it was, work. He came to the ward every day, and I showed him things that didn't appear in any formal documentation. The informal triage system the night nurses had developed for managing pediatric pain without waking every attending on call. The community health worker, a woman named Dolores, who technically worked for the city, but effectively operated out of our ward 3 days a week, connecting families to resources, and preventing readmissions by treating the social determinants of illness, not just the symptoms. The way Patricia ran staff meetings that somehow managed to catch burnout before it became turnover, which was why the pediatric ward had the lowest nurse attrition rate in the hospital. I showed him all of it, and he documented everything with the methodical attention of someone who understood that the difference between a number and an argument was context. In the evenings, sometimes, we went back to Wren and Sparrow, or to a Thai place on Meridian Avenue that we discovered accidentally when his parking spot turned out to be a block further than expected. We talked about things that were still work but felt like more than that. About what healthcare should look like at a systems level, about what communities needed to stay healthy versus what made hospitals profitable, about the gap between those two things and whether it could ever be closed. One night, walking back to the hospital parking lot in the cold, he said, "I haven't talked like this in a long time." Like what? Like any of it matters. Most of the time I'm talking to people who've already decided what they want the answer to be. I pulled my coat tighter. "You're talking to me like I might disagree with you." "You do disagree with me. Regularly." A pause, and I thought I heard something like warmth in his voice. "It's clarifying." I laughed, which surprised me, a real laugh that made a cloud of breath in the November air. He stopped walking and looked at me, and something in his expression was different, stripped of the careful professional distance, showing something underneath that was quieter and less protected. "June," he said, and it was the first time he'd called me that. Not Miss Hartley, not my full name, and it landed somewhere in my chest with a weight I hadn't prepared for. Before he could say anything else, my phone buzzed, an overnight colleague about a patient. I looked at the screen, and when I looked up, he'd rearranged his expression back into something more neutral. "Go," he said. "We'll pick this up." I went, but I walked a little faster than I needed to, and I wasn't entirely sure why. The board presentation was on a Thursday. Garrett flew to Atlanta on Wednesday morning, and I didn't hear from him. That was expected, appropriate, even, but the silence had a particular quality that I kept noticing in the spaces between tasks. Patricia didn't mention it. Dolores made a joke I didn't quite follow. Trevor from 407 had gone home, and the room had been reassigned, and I found myself thinking about $5 bills more than was reasonable. I was in the break room at 10:30 Thursday night when my phone buzzed with an unknown Atlanta area code. "The board approved the alternative restructuring plan," Garrett's voice said, and I heard something that might have been exhaustion or relief or both. No staff reductions. Community partnership funding stays. They're actually increasing capital allocation for the ward by 17% over 3 years. I sat down on the break room couch, which was ancient and slightly defeated, and pressed my hand over my mouth for a moment. "June." His voice was careful. "Are you there?" "Yes." My voice came out strange. "Yes, I'm here." I told them that the standard efficiency model would save money in year 1 and cost them twice as much in year 3 when their outcome scores dropped, and they lost their regional designations. I told them the community partnership wasn't a cost center. It was a retention and prevention program with a measurable ROI they hadn't bothered to calculate. Did they listen? Eventually. A pause. I also told them that I had documentation from a nurse with 0 dosage errors in 3 years, and a homemade protocol that worked better than anything their standardization consultants had produced. That seemed to land. I laughed again, that real laugh, and heard what might have been an answering smile in his voice. "I'm back Friday afternoon," he said. "If you're free Friday evening, I'd like to buy you something better than pour-over coffee." "I'm free," I said, and then, "Garrett, thank you." "Don't thank me yet." His voice was quiet. "There's something I need to tell you when I'm back, about why I got into this work, about some things in my history that are less," a pause, "straightforward than what I've shown you." The warning in his voice was so careful that I felt it land differently than a casual statement. "Okay," I said. "Tell me Friday." He told me Friday. We went to a restaurant called Oleander, which was the kind of place where the menus didn't have prices, and I wore the only dress I owned that felt like it might belong in a room with candles and wine that cost more than a week of groceries. He was already there when I arrived, standing when I walked in, and something about the look on his face when he saw me made my breath change rhythm. We ordered, and we talked, and it was the way conversation had been between us for 2 weeks. Honest, layered, occasionally challenging each other in ways that made the thinking feel better than usual. He told me about Pittsburgh again, but more of it this time, the years after college, when he'd worked for a firm that specialized in what they euphemistically called turnaround consulting for failing hospitals. Some of them needed turning around, he said, and some of them just needed resources and time, and for someone to stop treating community healthcare like a commodity. I was very good at the work, and it took me longer than it should have to notice that a lot of what I was doing was the second kind. What happened when you noticed? I left, started doing it differently, within a firm that had a better philosophy, or what I thought was a better philosophy. He turned his wine glass once. 3 years ago, I was assigned to an assessment in Cincinnati. Pediatric ward not unlike St. Catherine's. Underfunded, strong outcomes, community partnership that was being flagged as non-essential. I watched him. I made the same case I made here. I was overruled. The board had already decided before I walked in the door. They restructured the ward, cut the community program, realigned the budget. He was quiet for a moment. 14 months later, they closed the pediatric ward entirely. Insufficient patient volume because the community health initiative had been the primary referral pipeline. He looked at me directly. I wrote a report after, documented everything, submitted it to 3 different regulatory bodies and the State Health Commission. What happened? Administrative review. 18 months. A formal letter acknowledging that my findings were noted. A pause. Nothing changed. I was quiet. I have been trying to do this right for a long time, he said, and the flatness in his voice was the sound of someone who had used up the easy version of hope and was working with something harder and less comfortable. Sometimes it works. Sometimes the board listens, and sometimes I walk into a ward like St. Catherine's, where everyone is doing everything exactly right, and the only thing standing between them and closure is someone in Atlanta looking at a number without knowing what the number means, and I think. He stopped. Garrett, I said. This is what I needed you to know, he said. That this is not simple, that I operate inside a system that is frequently broken, and I am not always able to fix it, and sometimes being associated with me means being associated with that reality. I looked at him for a long moment. The candlelight made his face look different, less guarded, more worn, more real. You drove to Cincinnati and wrote a report that went nowhere, I said. Yes, and you came back to do it again. Yes, Garrett! I leaned forward slightly. I've been working in a broken system my whole career. I have held a child's hand while their parents filled out paperwork they couldn't understand to access care they couldn't fully afford. I have watched a hospital administrator explain to Patricia that the community outreach program is nice but not essential. I know what it looks like when someone actually tries. I held his gaze. You actually try. Something shifted in his expression, relief, and underneath it something more careful, more significant. I don't want this to be just professional, he said quietly. I should tell you that. I know what it complicates. I know the optics are difficult, I finished. Yes, June. The way you say my name is going to be a problem, I told him, which was not the controlled, sensible thing to say, but it was true. He smiled then, a real one, and it changed his face entirely. Is that a yes? He asked. It's a highly qualified yes with full awareness of the complications, I said. So effectively, yes. What followed were 3 months that I have difficulty describing without sounding like I'm narrating someone else's life. Garrett came back to Philadelphia on weekends when his schedule allowed. We walked through Fairmount Park and argued about healthcare policy, in a way that was somehow also romantic. He met Patricia, who sized him up in 30 seconds, and told me later that he'd pass, which was the highest endorsement she'd ever given anyone. I met one of his college friends, a structural engineer named Davis, who warned me that Garrett had a tendency to overwork and under-communicate when stressed, and that I should not hesitate to call him on it, which I appreciated for its honesty. It was not simple. He traveled constantly, Atlanta, Chicago, Portland, places where hospitals were being bought and assessed and decided upon. There were weeks when I saw him only on a screen, and I learned the particular texture of missing someone who was busy doing work you believed in. I had opinions about his decisions that I didn't hesitate to share. He had opinions about my tendency to take on extra shifts when I was worried about something instead of talking about it. We were both right about each other's blind spots, which was both annoying and deeply useful. In February, I was working a Saturday shift when 3 men came to the ward who were not patients or family. I didn't register them at first. Visitors came through regularly. But something about the way they moved, set off a low-level alarm that I'd developed over years of learning to read a room quickly. They asked for the ward administrator, were told she was unavailable, and one of them handed me a business card that read Corbin Makovich, Regulatory Affairs, Hallmark Health Solutions. Hallmark Health Solutions was a competitor of Meridian's. I told them the administrator would be available Monday and kept my voice pleasant and neutral, and when they left I took a photograph of the business card and sent it to Garrett with no context. He called me within 4 minutes. "Where are you?" he said. "Ward, 3 men, Hallmark Health." A silence. "What did they want?" They asked for the ward administrator. Said they'd come back Monday. Another silence. "June, Hallmark has been trying to acquire St. Catherine's for 2 years. Meridian outbid them. They have been," he stopped. "I'll make some calls. Don't talk to them if they come back without legal present. Garrett, what is this actually about?" "About the fact that I have documentation from the Cincinnati assessment that doesn't reflect well on one of Hallmark's board members, who was also involved in that decision. They know I have it. They've been looking for leverage." A pause. "I should have told you sooner. I'm sorry. So using me to get to you is a possibility." "Yes," his voice tightened. "I'm sorry, June. I thought I'd sufficiently managed the risk. I was wrong." I sat with that for a moment, the cold feeling of being a variable in someone else's calculation, even someone I trusted. "Tell me everything," I said. "All of it. Tonight. I'll be on the first flight I can get." He was there by 10 o'clock that night, and he told me everything. The Cincinnati report, the board member whose decisions had contributed to a pediatric ward closing, the quiet corporate retaliation that had followed Garrett's documented objections. It wasn't organized crime. It was the other kind. The kind in conference rooms with legal teams, where the damage was diffuse and the accountability was almost impossible to establish. "What are you going to do?" I asked. "Submit everything to the Federal Health Regulatory Commission," he said. "I've been building the documentation for 2 years. It's complete enough now that they'd have to respond." He looked at me. "It ends my relationship with Meridian. I'd lose this role. Probably several others. And Hallmark stops having leverage, yes, and St. Catherine's comes under independent oversight for the acquisition, which actually offers the ward better long-term protection than either private buyer." I watched him. "You've been waiting to do this. I've been waiting to have enough evidence." He met my eyes. "I have it, then do it. June, do you understand what this means? The professional fallout, Garrett." I leaned forward. "I work in a system that underpays nurses, overburdens staff, and makes families choose between debt and their children's health, and I show up every day because the alternative is leaving it to people who don't care. You've been doing the same thing from a different angle." I held his gaze. "Do it. I'll be here." He submitted the documentation on a Monday morning. By Wednesday, the Regulatory Commission had opened a formal inquiry. By the following month, the acquisition process for St. Catherine's had been paused and placed under independent review. Garrett lost his position at Meridian, which had been inevitable. He spent the following 3 months giving depositions, navigating legal processes, and working with a healthcare advocacy nonprofit that had been following the broader pattern of acquisitions that Hallmark had been involved in. He was thorough and relentless, and occasionally exhausted, and on the nights when the weight of it showed in the tightness of his jaw and the way he went quiet for too long, I said his name in the tone that made him look up and remember where he was. "You're catastrophizing," I told him, which was rich coming from me, and he laughed in spite of himself. "Pot," he said. "Absolutely," I said. "I know what it looks like from the inside." The independent review of St. Catherine's took 8 months. At the end of it, the ward was placed under a public-private partnership structure with the City Health Commission, which meant stable funding and oversight that insulated it from the kind of purely profit-driven decisions that had been threatening it. The community partnership with Kensington Family Health Initiative was formally written into the operating agreement. I heard the news from Patricia, who called me at 7:15 in the morning, when she normally would never have called before 9. "Junebug," she said, and her voice had the quality of someone who had been crying, but in a good way. "We're okay." I called Garrett. He answered on the second ring, and when I told him, he was quiet for a long moment. "Yeah," he said finally. "We did okay. You did more than okay, he said. The documentation, the ward data, your protocols, the community partnership numbers. None of it works without all of it. I smiled at my phone. Garrett. Yeah. Stop being professionally accurate for 30 seconds and just... We did okay, he said again, and this time I could hear the smile in his voice. More than okay. June, I need to tell you something. Tell me. I've been thinking about what comes next. Professionally, the nonprofit has offered me a role helping under-resourced hospitals make the case for their community programs before they end up in crisis. It's a pause. Considerably less lucrative. Does it matter? No, he said, and he sounded surprised by how much he meant it. No, it really doesn't. I came into the ward that morning with the particular feeling of a person who has survived something and come through it different but not diminished. Trevor had been admitted twice more since his first stay. Asthma flares, manageable, improving with the community health workers' help tracking environmental triggers at his apartment. He was 9 now and had opinions about hospital food that he shared freely. Garrett met me for lunch at the cafeteria, which had been his idea, and which Patricia viewed with the benign amusement she reserved for things she'd already approved of internally. He sat across from me at a table near the window with mediocre coffee and a turkey sandwich, and he looked more at ease than he had in months. I have a question, he said. Go ahead. Are you happy here? Not as a professional assessment, as something else entirely. I looked around the cafeteria, the worn tables and the vending machine that still occasionally ate quarters, the view through the window of the hospital entrance where families came in and out carrying the weight of things they needed help with. Yes, I said. Complicated, exhausting, broken in places. Yes, are you? He reached across the table and set his hand over mine, which was neither complicated nor ambiguous. Getting there, he said. I turned my hand over and held his, and thought about a girl who had gone into pediatric nursing because of what it had felt like to watch someone be kind to her brother in a frightening place, and how that one instinct had mapped the entire territory of her life. The ward, the work, the unexpected man sitting across from her, who had read thank you cards from children like they, were the most important documents he'd ever encountered. Some things you don't plan. Some things are just a bulletin board in a hallway and a moment of deciding to stop and say something real, and all the complicated, beautiful, difficult territory that opens up from there.